Hi, I am Dr Senthil Kumar. I am the head of the Department of Liver Transplantation and HPB Surgery at Continental Hospitals, Hyderabad. Liver disease is quite common in the general public, but the awareness is not. Globally, chronic liver disease is a very common cause of morbidity as well as death. A lot of importance has been given to heart disease and related conditions like high blood pressure, stroke, diabetes, and dyslipidemia, like lipid disorders, but not so much importance is given to liver disease, which remains silent for quite a lot of time before it manifests in patients. Chronic liver disease is commonly caused by alcohol intake. That is the most common cause. Other common causes are what we call NAFLD or fatty liver disease, which progresses to advanced fatty liver disease, which includes fibrosis and then cirrhosis. And the third common cause is chronic viral infection like hepatitis C and hepatitis B. The liver has got a huge capacity and takes a lot of injury and insult without showing any signs of it being injured. So people may not feel any symptoms or signs in the initial phases. It's only when the disease becomes chronic, when there is a lot of scarring in the liver due to repeated infection, and there is fibrosis and the liver shrinks. Only then people tend to develop symptoms like jaundice or bleeding from the varices, which causes blood vomiting, or passing dark stools, or collection of fluid in various parts of the body. Usually it's in the belly and it's called ascites, but they can develop swelling in the lower limbs or inside the chest cavity around the lungs called pleural effusion. The other common symptom of decompensation is when people develop abnormality in their brain function, and this is called hepatic encephalopathy. It has a spectrum of manifestations ranging from mild confusion to coma. So the importance of realizing that is that once it goes into a phase of decompensation, then the best option for patients is to have a liver transplant. On the early phase of the liver disease, medicines will help to slow the disease process and to some extent prevent some complications. But once it reaches the state of decompensation, go for transplant. If they do not go for transplant at this stage, then there's a risk of repeated hospital admissions, and each admission obviously carries the risk of potentially carries the risk of death, as well as will escalate the cost. So overall, going for the transplant option is the best for the interest of the patient, both medically as well as economically. So the message here is that have regular checkups once you're 40 plus, or you have risk factors for liver disease, at least annually, and so that things can be prevented early. And the second point is that once the patient develops any of signs of decompensation, best is to go for the liver transplant option.